What is this knee treatment? Kobe Bryant goes all the way to Germany for vertical line. Bleacher Report. Back to login. Sign up. Bleacher Report. Home. NFL. CFB. MLB. NBA. NHL. CDB. Soccer. UFC. WWE. Golf. More. Swagger. Video. Blogs. My teams. Edit favorites. Under the knife. Home. Archives. Under the knife. Want more real-time Under the Knife news? Visit Team Stream on BleacherReport.com. What is this knee treatment? Kobe Bryant goes all the way to Germany for by Will Carroll. Sports Injuries lead writer on October 4, 2013. 53,667 reads. 32. Share tweet. News that Kobe Bryant was headed to Germany for treatment on his knee broke late this week. The treatment was planned and expected by the Los Angeles Lakers medical staff and is a follow-up to previous treatments that Bryant has had on his knees. Bryant suffers from degeneration inside the knee and has had success with treatments in the past. There are so many questions about this treatment that I wanted to address as many as I can in hopes of easing the confusion. What is this knee treatment? Reported in many places as platelet-rich plasma (PRP) therapy, the treatment is actually known as a regenocin. It is similar to PRP, which I explain in this article, but has some notable differences. The therapy was created by Dr. Peter Welling, the German orthopedist. Bryant has gone to Dr. Welling at least 3 times, once per off-season, though he skipped it once. With regenocin, the blood is removed from a patient up to 3 weeks beforehand, mixed with other substances and then re-injected. It is believed that many U.S. patients have their blood drawn, frozen and shipped to Germany ahead of their treatment by an American affiliate, Dr. Christian Renna. If you wish to learn more about this procedure, the video to the right from ABC's Nightline gives more details. Why did he have to go to Germany? Because of those differences, it is not yet approved for use in the United States. The FDA has not yet approved all elements of the program, specifically the amount of time that the blood is stored before being re-injected. The FDA also requires that the blood be minimally manipulated before being reintroduced. The regenocin procedure does too much to be considered minimal. More simply, it's where Dr. Welling is from and practices. There's nothing inherently special about the location. Is it going to be approved in the U.S.? While the FDA would not comment on its current status to ABC News in 2012 and again to me in 2013, it is not believed to be close to approval status. As with many drugs and procedures, the FDA's process can seem excruciatingly slow but is designed to prevent new techniques and drugs with long-term consequences from coming to market. Is this blood doping? Blood doping refers to a specific practice once used in endurance sports. In this practice, athletes have blood removed as if they were donating blood. They wait several days for their body to replenish the blood supply, then reintroduce the stored blood. This increases the red blood cell count, theoretically allowing the athlete to carry more oxygen in competition. Spencer Platt/Getty Images. This technique attempts to recreate the effects of high-altitude training artificially, and was therefore banned in many sports. There are drugs such as EPO and Sero that cause the same effect without the removal of blood, but these are still banned in cycling in other endurance sports. The use of those drugs has often been termed blood doping as well. In tested sports, athletes still try to gain the added oxygen capacity by training at high altitude. Many boxers train in Big Bear, California, or in the Mexican mountains for this effect, while the U.S. Olympic Training Center is located in Colorado Springs. Athletes also use hypoxic training, where they wear a mask that restricts oxygen intake to simulate high altitude. Is it banned? Regenocin is not banned, and the treatment itself could not be banned by sports leagues. It is a medical treatment between the player and his physician. While blood spinning therapies do often add substances such as human growth hormone before re-injection, players in known drug testing situations must have this left out. As far as is known, no athlete has ever tested positive for any substance after regenocin or any blood spinning therapies. The involvement of Dr. Renna has also been a major sticking point in establishing the legitimacy of the procedure. If that name seems familiar to you, you might remember him from the BALCO investigation. Renna's Lifespan Medicine